Welcome to Aging with Dignity. I'm your host, Versha. Today on Aging with Dignity, I'm joined by Dr. Saskia Sivananthan, a neuroscientist and data scientist with decades of experience in dementia research and policy. Dr. Sivananthan is a partner at the Brainwell Institute and has served on national and international dementia advisory boards and has recently co-drafted the WHO Global Dementia Action Plan. We'll be discussing Mind the Gap, closing the care divide for Canadians with dementia. This is a major new report from the Brainwell Institute that paints a stark picture of dementia care in Canada, one where innovation exists, but care remains fragmented and families are often left navigating the system on their own. One of the biggest aha moments for me in this report is that in Canada, it can take nearly 2 years from the first signs of dementia to an official diagnosis, far longer than for conditions like cancer. And during that time, families, of course, are largely on their own. This conversation is important for older adults, adult children, caregivers, and families, whether you're in Montreal, Toronto, or across Canada, because dementia touches so many lives, yet our systems aren't keeping pace with the need. Let's begin. Saskia, welcome, and thank you for joining us today on Aging with Dignity. When families hear the phrase mind the gap, it can actually be quite abstract sounding. In everyday terms, what is the biggest gap this report uncovered, and how does it actually show up in the lives of people who are caring for someone with dementia?
First of all, thank you for having me on, Varsha. It's a pleasure to be here. And yeah, it's a very good question. The reason we used the term mind the gap is we were sort of harkening back to those who are familiar with the subway in England. And actually, I think they even use it here, is the gap between when the door opens and the gap in the platform when you step onto the platform. And it really was a warning to people who are living with dementia, families, care partners, or potentially worried about it, that there is a significant gap, A, in being able to get the diagnosis, but if you even get the diagnosis, a big gap between what we might expect would happen in terms of the kinds of supports and care versus what you actually get. And unfortunately, not in a good way. But we didn't want this to be a report about what all the problems were, because there have been a lot of those. We really wanted to try and get to the point of what's a solution. Why is it that we are not delivering the kind of coordinated, timely diagnosis and care that we as Canadians have come to expect? And in order to do that, we explored what international countries have done and have better systemized care, as well as what we've done internally with other major diseases like cancer, stroke, mental health, and diabetes, are others that we did explore but were not in the report, to really make it much more of a productive conversation. Here's how we can move towards the solution.
So, the coordination is important, and many caregivers tell us that they're feeling like they're constantly starting from scratch every time they're having to explain their loved one's situation again and again and again as they really move through the system. Why does dementia care in Canada feel so fragmented? And what does that report actually show us can be done better in Canada?
Hmm. Yeah, it is fragmented, and the reason people are feeling that as they are moving through the system is because there are no clean or clear connections across the different sectors. So I'll give you an example. If if you get a diagnosis from your family doctor, let's say, which is where the vast majority of people start, um, he or she can tell you what the diagnosis is, but then there's no one really helping you understand, well, how do I access home care and community care? When do I access that? What does that look like? Or should I be accessing seniors' mental health services or day programs? That connection isn't there. Let's say you go to a day program and you're learning about the kinds of services that are available there. Well, then there's no one who can tell you, if you're worried about trying to get a diagnosis, here's where you need to go. Or if you're concerned about long term care, here's what that needs to be. So each of these key components along a very long care trajectory or pathway for dementia is isolated. And so, who is the connecting point? It's the family, it's the caregiver who knows the story, who knows what the concerns are, and then has to go and find that information. And sometimes they don't even know it's there. That is the fragmentation that we're feeling and seeing. But this was the whole point of the report. We know that doesn't have to be the case. And we use cancer as an example of, again, a very fragmented system when it first started. And I'd love to actually delve in a little bit more around the stigma that people living with cancer experienced, like pre 1970s. It almost identically mirrors what people living with dementia and families are dealing with right now. Fragmentation, no real coordination or pathways, a lot of hopelessness, that there's not much you can do about it. So why even bother? Why even make the connection? And also quite a bit of, well, until a therapy shows up, you kind of just wait it out. And so delays in accessing and resourcing. And those were very similar to what people living with cancer experienced earlier on. And now you have a system in which almost immediately after you get a diagnosis, there are follow-up appointments. You have a specialist who is ready to help you and support you. They start talking to you about what your palliative care options are, even if you're not at palliative care stage, but preparing family and the care partners, right? Home and community care. And there's a gentleman that I work very closely with, Roger Marple. He was a mentor, a person living with dementia as well. And he, in the end, was diagnosed with stage 4 lung cancer. And he said it was night and day in terms of when he got the diagnosis of dementia. And for a good 6, 7 years, kind of just had to figure it out for himself versus when he got the diagnosis of lung cancer. And the supports were immediate. That is the system that we know can be built and needs to be built for dementia.
That's some interesting points, Saskia. It's the perceived stigma is very real. The feeling of isolation, the lack of information. My hope is that through the work that you're doing through your institute and other organizations, we can collectively move that needle away from the fear, even if it's just a notch or two to getting informed while you're still in the doctor's office. Now, I know through the report that was done as a collaboration with the WHO, you looked at different countries. Are there learnings that we can actually pull, any best practices from other countries that we can incorporate here into Canada, even at a very local level here in Quebec or Montreal or in our local communities?
Yes, there is. And in fact, what we did was we pulled out what we call the 6 ingredients of success. And they can apply at a federal level, they can apply at a provincial level, but they can apply even within your family when you are supporting someone living with dementia. And a lot of it actually comes from project management and change management literature. So the first is, if we're using sort of system level language, it's governance and clear roles. So if we translate that to even at the family level, are we clear about who's responsible for what? So if mom has dementia, am I the power of attorney? And therefore, as power of attorney, is it financial and medical, or only financial, only medical? What kind of decisions does that make? Having that conversation, being very clear about how those decisions get made and the autonomy and the role responsibility to then deploy that. Measurable goals. This is actually something that I really encourage families to think about and for people living with dementia to think about. What are important goals for you? What's the purpose that drives you every day, that motivates you? And how do you build those goals for yourself so that living with dementia, these are still achievable? People often think, well, I have dementia, so now I can't do any of these things, or I'm eventually not going to be able to do any of these things. And that may be true, but this is a long time span when someone is generally living with dementia. There's a lot of opportunity to achieve those goals and work towards that purpose and maintain that purpose. Now, if you translate that at the system level, measurable goals are equally important if you're trying to build a system that's coordinated. What does that really mean? And I'll give you some more specific examples. But those are the 2 ingredients. Another ingredient is sustainable resourcing. So at a system level, Have we provided the finances to achieve the goals we've set for ourselves and the human resourcing to do that? Now translate that even at the family level when you're living with dementia and thinking about the kind of goals you want. Have you talked about it financially? What are our resources? What do we feasibly want to be able to achieve? Does that mean someone needs to stop working, or does that mean that we need to consider different care options based on what those goals are? The fourth ingredient is clear timelines. Now, at the system level, that means if you're saying you want 80% of people to be diagnosed and to receive a formal diagnosis of dementia in the country, and spoiler alert, it's probably 50% in Canada. Well, okay, what is the goal? What's the timeline to get to that goal? The same applies if you're a family and you're thinking about the kinds of timelines for the goals that you have for your loved one or that your loved one has set for yourself. And then the last two pieces are strong monitoring and transparent reporting, which is probably more applicable at a systems level. But again, with families, as you know, Varsha, so much of this is about how you communicate with each other and how transparent you are in that communication. Like if you're really seeing some progression or symptoms occurring, being able to be open about that with each other and discuss how you support your loved one in it. So those are sort of the six ingredients at the system level that are very much achievable for Canada in our health system. And part of the reason for that is the countries we looked at are countries that are set up just like Canada. So it's a federated health model. What that means in everyday language is that the federal government can provide funding, but it is the provincial government that makes the thing happen, that operationalizes it. And the two roles are very distinct. The federal government cannot step into the provincial government's role around how to operationalize. They can convene and support, but not dictate, and vice versa. Well, if you look at countries that have a similar setup, and you would have heard and discussed these, I'm sure, but countries like Scotland, Denmark, Germany, Australia, these are countries that are really, they seem quite far ahead in terms of providing really well supported care that is integrated with very clear next steps for people living with dementia and their families. And they scored 9 and some 9 and above on the a matrix that we had measuring how they did against those 6 ingredients of success. And it's because they deploy most of those ingredients in terms of really supporting the coordination. But I can share some more examples specifically if you're interested later on, perhaps.
Saskia, I love that. I think it's the exploration at the federal and provincial level with the systems is very important because that's what really helps to set the structure for the community that we're in. But I love that you've been able to bring those ingredients down to the personal level, the family level. And if you're okay with it, I'd like to actually publish that in our care toolkit, so our listeners can actually have access to that and start to incorporate it into what they're doing in their way of living with this today. There are learnings from other countries that you've just touched on. I will be doing a future session on communities and community caregiving. There's a lot, again, we can learn from other countries. One of the things that we're finding is that caregivers, especially those that are adult children that are taking care of their parents or their spouses, are really carrying a heavy load. Were there any learnings that you were able to identify through the report and your research that families with caregivers that are within the family, as opposed to just paid care providers, can actually learn and build and make a difference in their day to day living?
Yes. Now, this wasn't embedded in the report, but it's been learnings from working with people living with dementia and their care partners and families. And it was a very interesting piece that was raised by a friend of mine, in fact, Stephanie Musket, who supports caregivers and care partners on their journey. And we often talk about, especially as family caregivers, right? Like not a paid caregiver, that you need a village. And this is true. You do need a village of people, lots of different people who appreciate where things are and are able to support as needed. But there is a distinct difference between a family caregiver and a paid caregiver. When you are paying someone, and there's something to be said about that, to support you in the care, there's no return expectation, right? Because the financial transaction is what enables that. However, if it's family caregivers, there's a give and take on all of those pieces, and we don't always think about that negotiation that happens. And the other, I think, has been the reality that not every family has had or has great family dynamics. That's a reality. Some parents have not had good relationships with their kids and vice versa. Some of the children might not agree. And now, as adults, those dynamics do get carried into how we are caregiving and the expectations of caregivers. And so I think it's really important to acknowledge that, to not just expect that someone is going to step in, is going to caregive exactly the way that you would expect, give up their jobs, move across the country and do that sort of thing. That there's dynamics to the relationship that need to be accounted for. But what has always come up over and over again, and even though I say it, I know it's easier said than done. It is that you need to, if you are a family caregiver or a partner, adult child or spouse, ask for the help early, earlier than you think you need it. And it's almost always the case, but put the supports in even if you don't need it. Even if you don't need help with housekeeping, get it in early if you can, or ask for that help early. Because by the time you've burnt out and burnt both ends of the candle, by then it's too hard to be able to recover on all of that and still be able to maintain the level of caregiving that is expected as dementia progresses.
And the lead time for any of those services is quite long. So you might need a little bit of help today. You will need more tomorrow. Start early. Absolutely. It's interesting because the family dynamics one is one that I lived, and I'll tell you there were a couple of moments, two specifically, where something was said once by my sister, once by my father, that made me feel seen, and it meant the world of difference. It didn't change what I was doing, and I didn't need the pat on the back, but to feel like I was seen in the process. So again, another throwaway comment in some sense, but if you've got caregivers in the family and you're not the one participating actively, reach out and share your appreciation. It goes a long way. I'd like to take a step back, Saskia. Can you talk a little bit about the Brainwell Institute? What's its mission? Why was it important to be involved in co-authoring Mind the Gap? Can you talk about your organization a bit?
Yeah, absolutely. So my previous roles, well, maybe I'll take a step back even further. I trained as a neuroscientist originally, and so a lot of that is what we call clinical or bench work. You're in a lab, and it was on dementia because this was still an area I was interested in, but I didn't actively work with people living with dementia or even necessarily within the health system. But during my graduate studies, I met a gentleman who was my neighbor at the time, Vince, who had cognitive impairment and lived alone, and also had many other health conditions. And in essence, I became his proxy caregiver, and I really saw firsthand all those gaps in the day-to-day things that he needed that no one was able to fill. And this is for someone who lived alone, so did not have a caregiver or family, at least not family who was available. And in the end, he passed away alone in an ER in one of the hospitals in Montreal. And he had no one with him, no one knew, and it was just over the holiday break. And so I often think about him when we go through the Christmas season. That was what really changed the trajectory for me personally. It was recognizing that I needed to and wanted to have a more profound, if possible, day to day impact. And I saw how much, even as a proxy caregiver, that I was able to have that impact on Vince. And I then worked in different roles within government. I worked at the WHO and at the Alzheimer's Society of Canada. And the very, very big gap that we saw was excellent research being done, these wonderful programs being created to support people, but they were clearly still not being integrated in a meaningful way so that if someone is coming in and has received a diagnosis, they know way ahead what to expect, what the next steps are. They're preemptively offered the programs and services that are meaningful to them. And that was why we co founded the Brainwell Institute. I co founded it with Alexandra Waite, who's also a researcher and also had firsthand experience. The intention of the Brainwell Institute is it's a nonprofit think tank. And ideally, I would love to come back in 5 years and say, I've been able to wind it down because we have achieved the goal. Because the goal and the purpose is to ensure that we have coordination of care, that when someone has a diagnosis and a family member is there with them, they are not left alone, that they are not just told and then move on and come back maybe in 9 months to a year or, come back when things are worse. No, that you are supported early, that you know about your rehabilitative options, that someone continues to talk to you as a person. You don't have your entire identity stripped of you just because you now have this diagnosis. You as a person exist. What do you want? How do we support that? This is what you can expect. It's a difficult trajectory, but there is someone here walking with you all to support you along that. That is the goal. To achieve that, you need the policy, you need the resourcing and the infrastructure at a health system level. And that's what Brainwell is here for.
It's wonderful, Saskia, and I thank you for launching that. I appreciate that the report actually doesn't just describe the problem. It actually looks and asks us to rethink how can we care for the people and the families that are living with dementia. Um, can you talk of any signs of progress that you are seeing here in Canada and where we can continue to improve? Is there anything that we as families and caregivers can do in our roles to help push that change forward?
Yes, very much. It's a resounding yes on the front, Versha. And I'll tell you why. Um, well, going back first, there has been good progress in that. Look, we were one of the countries that developed a national dementia strategy at the federal level. At the provincial level, we have many provinces that have good dementia strategies and some that have been operationalized quite well. The Quebec Alzheimer's Plan is a good example of that. So there's definitely been progress in that we're not pretending this is a disease or a condition that doesn't exist and doesn't need support. It has been prioritized. And in fact, quite a bit of funding has also gone towards it. With the National Dementia Strategy, over $70 million flowed out. And that's a significant amount. Now, is it as much as could have been and should have been for coordinated effort? That's a different conversation, but certainly it's a good amount.
Well, given the trajectory of the number of people diagnosed with dementia in the next 4 or 5 years, it's certainly a drop in the bucket. But
Exactly. It is. It is. And that's the reality of it, right? And we're seeing the impact on that in our health systems because we're working in multiple provinces and you're seeing very long ER wait times. You're hearing about bed blockers. I hate that term, but it's used for primarily older adults or people with cognitive impairment who are in hospital waiting to be discharged and cannot be safely sent home anymore. Well, what are they supposed to do? It's not their fault that this was the only place that they could be to be able to access the kinds of systems they need. But you're seeing a huge number of that. They're called ALC beds, alternate level of care, because they don't require the same level of um, support as you would in an ER. But because there's nowhere else to go, they're in these beds. But think about the cost of all of that. The cost of providing care to someone in an ER, acute urgent care setting, is astronomical by design because you're not meant to be there for more than a couple of days to deal with a immediate problem. But we're putting all of that into people who have chronic long-term conditions that are being poorly managed and poorly coordinated in the community, and that's why they end up there. But this is all that pressure is now in our health system. And we know with the growing number, we're looking at over 1.7 million people who will be developing dementia. And then for each person who has dementia, there is at least one care partner, if not many, many more. right? We don't even think about that. And there's the productivity of that too, right? So a lot of those folks might need to step away. They might not be able to be as fully engaged in their work as they originally had planned to be able to provide that unpaid care. From a health system perspective, all of that is very much present. But the hopefulness for me, again, it comes from watching how people, because it is people living with dementia, it's care partners who, once they have had a chance to grieve, because there is a grieving process with a disease like this, and have had a chance to come to terms with their condition, who are raising their voices, sharing their stories, and asking and demanding for that change. For a long time, because of the stigma, we had only a handful of folks who were willing to talk about things and share what their story was. And now more and more people are able to, not feel like they have to be in a corner and in a dark shadow around this, but to be able to share and ask. And that kind of movement, that is what happened for HIV/AIDS. It was a huge movement of patients who demanded and wanted the changes and access to treatment and resources. Enormous movement for cancer of patients, families saying, enough is enough. This is not okay. We want and expect this level of care. And this is where harnessing and being and sharing that experience is essential for people living with dementia right now.
Absolutely. Saskia, thank you for all the work you're doing through the Institute, co-authoring that report, Mind the Gap. I think you've given us a really good understanding of the structure of the systems, but you've also brought the human reality behind dementia onto the table as well. And I think that's very important. You say it yourself. It's about the humans, it's the people that are involved. And we live with this disease at a very granular level. Within the family environment at best. You've also mentioned there are people that are on their own, right? That don't have the family network. So where are they falling? A lot of work needs to go on here. I would like to thank you so much for all of the work you're doing. If you reach that target in 5 years or even sooner, please come on. I will give you as much time on this podcast as you need.
Wonderful. I appreciate that.
Okay. Thank you very much.
Thank you, Varsha. It's a pleasure to be here.
Today's conversation with Dr. Saskia Sivananthan brings us back to a truth many of our listeners already know in their bones. Dementia care in Canada is not short on good ideas or dedicated people, but it is short on coordination, accountability, and clear pathways for families. The bottom line for Aging with Dignity listeners is this: when systems don't connect, families are left to fill the gap. Adult children, spouses, and caregivers become navigators, advocates, and case managers, often while grieving, working, and caring for their own health. That burden is not sustainable and it's not dignified. Mind the Gap reminds us that innovation alone isn't enough. What families need is care that is timely, person centered, and consistent, no matter where you live in Canada. And what caregivers need is recognition, support, and a real seat at the table. If this episode resonated with you, know this: your experiences matter, your voice matters, and sharing these stories is part of how we close the gap together. If this episode sparked something for you, please share it with your families and friends. And don't forget to hit like and subscribe to this podcast if you're enjoying what you hear. Thank you for listening in and sharing your time with me. Please join me each week for new insights into aging with dignity. And until next time, reminding us all to age gracefully and live vibrantly. Everything you've heard today, just real talk. It's just our personal stories, experiences, and honest opinions. This podcast isn't providing legal, medical, financial, or therapeutic advice. And no, listening doesn't make me or my guests your lawyer, doctor, financial advisor, or therapist. The guests and I are here to share stories, spark ideas, and hopefully give you something to think about. When it comes to the big decisions, make sure you do your homework or check in with the experts who know your situation best. We're here to keep the conversation going. You're the one in the driver's seat.